Dr. David W. Kim. This is part 6 of our structural rhinoplasty video blog. We've talked all about structural rhinoplasty, and now we're discussing how those principles are relevant to the specific anatomical subsites of the nose. So the middle vault is the part of the bridge that resides in the central portion of the nose, or the middle third of the nose. This is an area that often needs to be altered in order to make the nose straighter or to reduce a hump on the nose. Then this is a very important area with regard to structural rhinoplasty because this is an area where we tend to see problems. Most commonly this happens when we're removing a hump on the nose. So the hump is not only bone as some people think, but it's an excess of cartilage on the bridge of the nose. As I said previously, the nasal septum serves as a wall that holds up these upper cartilages, which serves as a roof. So if a hump is removed, we've uncapped the middle portion of the nose and created a separation of these upper cartilages from the septum. Now, if nothing is done except to let the body heal on its own, these upper cartilages will tend to start coming inward and pinch. And what that creates is a situation where we lose the normal smooth contours of the nose, where these light reflections have a smooth transition from the brow, the side of the nose, to the tip, and instead have something like this, where the normal width that's here is lost because the central portion of the nose collapses. This is often called an inverted V deformity because you see this upside down V shape, which is the contour of the lower portion of the nasal bones. Prior to surgery, this contour was hidden because these upper cartilages were flush with them. But after a hump is removed, if the central portion of the nose is not restabilized, we see this inverted V. Now, structural rhinoplasty employs techniques to prevent that collapse, and the best technique, in my opinion, are spreader grafts. This is the use of small rectangular portions of cartilage that go between the upper cartilages and the septum along their cut margins, along the bone, along the bridge rather, and they're sewn together in order to resupport the nose. This maintains the appropriate space and prevents that inverted V deformity. The other option is to not reduce the hump at all. Sometimes in an individual like this, you see what looks like a hump and it's tempting just to lower it by cutting it out. But instead of doing that, we can consider placing some material like cartilage above the hump to mask it. And you can see that here in this individual. No hump was removed, but a small cartilage graft was placed above to maintain the strength of the nose while maintaining and creating a better triangular profile. So the hump looks like it's gone. It actually hasn't been removed. Something's just been added above it. And this obviates the need for spreader grafts or eliminates the risk of any of that collapse and inverted V deformity. This is another patient. This is a computer animation or computer morphing exercise which I performed. This is him before surgery. This is one version which shows the profile a little bit straighter. In this first version, what I did was through a computer removed the fullness of the hump on his bridge. This is a second version where I left that curvature alone, but instead augmented the nose above it and augmented the tip. Now, we chose this technique because of his thick skin. With thick skin, as I mentioned earlier, we may not be able to actually create this type of change because even if we reduce that bone and cartilage, the skin may not be able to drape cleanly and would result in a polybeak. Instead, we elected to add a little material above and bring the tip forward to stretch that skin envelope and create a more predictable result in this thick skin individual. And this is his actual postoperative image. The next section is on nasal tip position. Once we violate tip support mechanisms, we have to reconstitute them, or we may have problems like this, where the tip scars upward uncontrollably, or the tip loses support and creates this rounding. We'll conclude in the final lecture on how to maintain tip position and support so these type of complications don't happen.